So, good morning, everyone. It's wonderful to see you. So glad you could join us for another community conversation. We're here with Mitzie Watson, who's from Texas, and we're going to be talking about personal care homes today. And if you've never heard that word, which I had never heard that word, um, those words. We're gonna delve deeply into what that means, especially as people are aging or changing in their needs, their living needs. So with that, I'd like to welcome Mitzie Watson. Mitzie?
You for having me today. I just wanted to talk to you a little bit about personal care homes that can also be called other things. So we're going to talk about that as we go through. Um, so I want to give a little bit about my background and how I got to where I'm at. So I'm a nurse. I'm a registered nurse. My background is maternal child health. So I did labor and delivery, NICU, pediatrics. But in 2011, my mother was diagnosed with mild cognitive impairment. She was about 75. And we soon figured out she probably shouldn't be living alone. So she came to live with me, and I took care of her for the next 9.5 years. And that is what led me to look at the senior industry, because when I would take her to the hospital and we'd go through rehabs and go for doctor's appointments, and little seniors would show up that had no clue, that they were on the wrong date and they weren't at the right time. I mean, there's just a lot of advocacy that we can do for seniors and their families. So that's how we started our journey with assisted living locators. And so as I took care of my mom, she didn't have the funds to be going to um, a normal assisted living or memory care. And so we had to look at alternatives. And so we ended up choosing a personal care home that was owned by a nurse. It was licensed. They actually allowed me to work there as a nurse to help defray her costs. Otherwise, she would have been in a skilled nursing facility.
Wow.
So that's
So that's
that's
something that can be that's so interesting. Yeah. And I know that Ray Drazen said that personal care homes in California are called border care homes. So one of the things that we're going to be talking about today is that different states might have different rules
oh,
and
for
that
sure.
kind of thing. Yeah.
For sure. So most everything I'm going to tell you today will be from the standpoint of Texas. There's no way for me to know every law for every state. But I did, because our franchise is a national franchise, I did reach out to my peers and just get from them some of the communities that, or states that just don't allow it. And there were like three, there's probably more, but these are the ones I heard back from, and they were Connecticut, New Hampshire, and Ohio. So, but in Texas and California, I will say California probably has more tough regulations than we do in Texas. But some of that sets the standards too for the other states to follow suit. So that's not a bad thing. So um, So anyway, what we're going to talk about, I'm going to first describe skilled nursing, because skilled nursing is a nursing home, and things that take place there, these residents need higher level of care, like a lot higher. Like they may have IVs, they may have PICC lines, feeding tubes, gastrostomy tubes, just wounds, they have wound care needs, things like that. So those are residents that really do need a skilled setting. A lot of people will think, well, my mom's ready for the nursing home. And when you start talking to them, you realize they don't have a need for skill. They just have a need for good care. And
Mhm.
so that's where these personal care homes can come in place and play a great role in keeping them out of a skilled nursing facility, and in an environment where it's more lively, maybe depending on their needs, or if that's not what they need, then the care home can be a very quiet and home-like setting. So that's really, for some people, especially if they're coming from home, a lot of times that's a good transition for them. Um, so another alternative in your home would be in-home care, where we just have, like it's almost like a, I don't want to call it a sitter service, but they come in and they may do some laundry for you. They could help you shower. They could take you to the store. In-home care, it allows you to stay in the home independent a lot longer.
More like companion
Yes,
services.
companion care.
Yeah, yeah.
And a lot of people will mix that up with medical in-home health, where they come in and they do therapy in your home, PT, OT, speech therapy, and all of those services for someone living in a personal care home. Those services can actually come out and be done in that setting. So the next thing I want to talk about is large assisted livings. So you have the big name brands like Atria and Brookdale and, the big ones. And those are great, I think, for residents that are still pretty high functioning. They just need some extra support, to live independently as long as possible. But I do feel like at some point, it becomes where their needs are a little bit too high to be one of 12 to 15 residents for a caregiver to have to look after. If you've got 3 or 4 that are that high level, and then the others, some care is going to suffer somewhere. And so at that point, a residential situation may be a better option.
So,
So
and there are standards in terms of ratio of staff to residents. Is
yes.
that standard nationally, or is that?
Well, the state regulates. They don't tell you, in Texas anyway, how many caregivers you have to have per residence.
Mhm.
That's kind of left up to the building, of what they choose and how they do that. But it's pretty standard in Texas to have maybe, 10 to 15 residents per one caregiver in a
Mhm.
larger community. If it's memory care, the ratio is usually a little bit less. So, um, memory care is also like a type B. I'm going to go through into the types here in a minute of what they are, but a type A assisted living is for higher functioning residents. And when I say assisted living, this may be in a large community or it may be in a care home situation, care home. Um, so a type A just means they're still pretty mobile. They can get around the house. They can, it may be with a walker, that's fine. But if they're in a large community, they have to be able to get themselves out of the building with only verbal direction from the EMS system and staff within a 13-minute period. Okay. And so that's true whether it's in the home or the
Mhm.
larger. A type B is these residents require more care, more hands-on. And in an emergency, they may be in wheelchairs or they may be in beds, and have to have help with transferring. It's going to be upon the staff and the EMS system to evacuate them in an emergency. But they can take care of them, usually a type B, through end of life with
Mhm.
extra support services coming in, like hospice or something like that. And so that same rule applies also to the care homes, okay, that are licensed. So we're going to talk a little bit about the personal care homes and how some of them are licensed and some can be unlicensed. And so In Texas, our licensed care homes, they run under the same regulations as the large assisted livings. They're inspected at least every 2 years. Someone comes in and they're monitoring, and we can go look at the state Health and Human Services site and see what their state report inspections are. And so I'm sure each state has their own. I'm not sure what they're called in your particular state. And then,
And I think it's great that people from the audience are putting in the chat what your experience has been. So that's really super helpful too. Thank you for contributing.
Absolutely. Okay, so, and then we talked about type A, type B, type C is more of a foster care situation. These individuals are pretty high functioning. They just kind of need someone supervising their daily, maybe reminding them to take medications and things like that, but they should be able to take their own medications just with a little reminder, you know. So we don't have a whole lot of those in this Dallas-Fort Worth area. So,
Why do they break out C from A?
well, because in an A, I'm not sure. The assisted living, they're actually providing services that are potentially more intimate, like they may have help with showers,
Mm-hmm.
may need help in the bathroom, things like that. And in the foster care situation, it may be someone that has maybe a mental diagnosis of some sort, or they're just elderly, but they're still pretty well functioning. But they're usually a cheaper way of having a place to live. So
Mm-hmm.
sometimes these folks have very low budget as
Gotcha.
well. So, um, so I wanted to talk a little bit. So personal care homes, assisted living homes, residential care homes, these are all the same thing. Okay, so you may see them used interchangeably as far as what their title is. Um, so I wanted to talk a little bit about a licensed one and an unlicensed one. So the licensed care homes, when you go in, you're probably going to see things on the wall that are required to be there, like their licensure certificate, um, the resident's bill of rights, because they do have rights, um, how many people the house is licensed for. They may have their inspection report up there. If they don't have it up there, it needs to be somewhere easily accessible so families can look at that and see how the home is being rated. In the licensed homes, you'll see activities, calendars posted. You'll see their diet, their menus posted. One good thing about diets in these care home situations is they're kind of catering to maybe 4 to 8, sometimes 10 or 12, but still not 150 residents. So they have more flexibility. They have to post what they plan for the day, but it could change. Like if the residents are going, we really don't like that, then they can move things around a little bit and have some flexibility with that. So it's just making sure they have good, nutritious meals offered, 3 times a day. So you may also see fire escape routes, all the legality stuff, up on that wall and in the walls from each of the rooms. Okay.
Mm-hmm.
Um, you don't have to have a nurse on staff, but I really like working with communities that do have a nurse on staff. Um, for example, we have a few larger named ones that don't have a nurse on staff, and I don't usually refer to them, mainly because I want medical eyes on these seniors because at any point things can head south, and when they do, that it can go quickly if you
Mhm.
aren't observant and don't know what you're looking for. So I really appreciate the nurses being there. Um, but in Texas, you're not required to be a nurse to have a residential or personal care home. Um, Another thing we talked about was the ombudsman. So every state requires that an ombudsman be available to serve the licensed care facilities, the large box ones, and also the smaller licensed personal care homes. And what that person does is they're an advocate for the resident. And if there's an issue that's going on that can't be resolved, then they're a mediator and they try to help fix the situation so that everybody's happy. Because the main goal is to have a resident that's happy, getting the care they're paying for, that kind of thing. So it's really
And
good.
that is a federal program. So anybody in any state can look up the LTC long-term care ombudsman program that is required by law. So, yeah.
Yes. So, anyway, those are some of what you will notice in a licensed. Now I'm going to talk a little bit about unlicensed.
Hmm.
So, let me pull up my thing here. So,
Yeah.
in an unlicensed, go ahead.
I was going to say, Deidre said that she has them on speed dial.
Yes.
Yeah.
So I have some unlicensed care homes. The in Texas, you don't have to be licensed, but the state requires that you only have 3 residents.
Mm.
And so a lot of times folks will try to open an unlicensed home and have 5 or 6 residents. Well, technically, they're not supposed to, per the state. But I work with several that are nurse owned, totally comfortable with referring to them because I know they're in the homes, they're seeing the residents, they're looking at their plan of cares. I work with them. If I had to, I don't really refer to homes that are not nurse owned, that are unlicensed, because there's just things that can go wrong. Okay. We're going to talk about some of the pros and some of the cons of, the each type of community. But there's just a lot we don't want to happen. The nurse owned ones too they can do a lot of things that like even the large box assisted livings cannot. Um, they may be able to take a feeding tube because they have a licensure that they can train their staff under their licensure and be able to take like a feeding tube. They can train them how to do the feeding tubes. They're caregivers,
Mhm.
and then they're kind of putting their business on the line, their licensure on the line if they don't train them properly and assess their ability to carry out those plan
And
things.
Ray Drazen asked, why wouldn't a home obtain a license?
Well, that was kind of the reason there. For a nurse, she can take some of the things that the larger communities cannot. Okay. So she doesn't need to have that licensure. She doesn't necessarily want the oversight and then telling her what she can and can't do with her residents. As long as she's keeping her residents medically, all of their needs met, she can do a lot for them that the larger communities can't. Otherwise, they could have to go to, like a skilled nursing facility. So it's kind of like that last step before actually having to be, you have no other choice than to be in a skilled nursing facility.
And I'm imagining that that cost is a lot less than a skilled.
Typically. But
Hmm.
if that resident has a lot of high level needs, the rate can still be up there.
Hmm. Hmm.
So Uh, Around here, a skilled nursing facility, I would say you're probably going to pay between 6 and 7 thousand a month in a nursing home
Wow.
if you're private paying.
Hmm.
So,
And Mitzi, do you have any folks who are covered by Medicaid in those homes?
so the care homes, all of assisted living, they're private pay.
Yeah, all of them. Yeah, I just wanted
We
to check because
have
that.
we have so in Texas we have a program called Star Plus Waiver, and it can cover assisted living if they qualify medically and financially. So the wait list for that is usually 6 to 12 months, depending on how many's on that list. There are a few care homes. It's really hard to get qualified from the state with these care homes to be able to be paid by Medicaid to live there. So there's
Hmm.
only a handful that I have that do that. So okay. So another thing, like in the nurse-owned ones, they may take residents that are Hoyer lifts, um, need two-person transfers, and so they just staff accordingly because with Hoyer lifts and people who can't transfer on their own, you need two caregivers. So that's where the cost can go up because she's covering the cost of two caregivers to care for these people. So um, with either one, um, there's always 24/7 caregivers on site. So some of the things that are differentiated between licensed and unlicensed um, is the licensed care homes must have a fire suppression system. They their night staff has to be awake at night. So in an unlicensed one, they may not have that. They may not have the fire suppression system, and that in a lot of cases is kind of the big hold out on why they may not get licensed because it's like $50,000 up front to get your home
Hmm.
fire safety, right? So um
They might not be able to make that up financially.
not
Yeah,
yes.
yeah, yeah.
Not for a long time, or yeah,
Hmm.
to just get in there and do it prior to getting it opened. So hang on one
Robin, did
second.
you see Ray's question about how are unlicensed homes regulated or are they unregulated?
They're unregulated.
Mhm.
So they don't, but like so some homes will, I told you, try to squeeze in more residents, Um, if they are found to be providing services and have more than the three, at most four residents. If they have six residents, um, someone turns that into the state will come in and they'll shut them down or they'll have them move residents to some other care home. So they're not regulated by the state, but there are rules in place for those care homes. One of the they come out every couple years for the licensed ones, and they don't at all for these unlicensed ones. So that's one of the biggest things about my job that is a big thing for me is in these homes, I know what they're capable of doing care wise. And we just don't entertain the idea of somebody going somewhere that shouldn't be there, that they can't meet their needs. So
Do you have any personal risk from your business perspective in as try to find the right fit? Like what, because you're part of a franchise of companies all across the country that do this work. So, and I'm imagining that a lot of people online probably partner with people just like you all over the country. So, is there risk in that to you or your business and you know, not finding the right fit or?
I mean, there absolutely could be. We do the best we can to match people up. It becomes very difficult when we have low budget residents and they can't afford to be in some places. Then we have to kind of consider some of the unlicensed. But again, that's why I don't really refer to anything that doesn't have medical eyes on them, because if it were unlicensed. But you want to be, we've got to protect ourselves as well. So you always take that into account. I worked too long and hard for my RN degree. I'm a certified senior advisor, and we really do try to do the best thing for the resident. When we are in that situation of maybe an unlicensed setting, the family knows, it's all explained to them, the differences of how it could work, some of the pros and cons, and we're going to go over some of those here in a minute. But I make sure they understand, and we can have them sign a waiver also saying, I understand that these are the differences. It's been explained to me. So yeah, and I'm part of an organization called National Placement and Referral Alliance, and we're actually trying to, it's a professional organization that's trying to raise the standards for what we do in placement. And so I would suggest to anyone that if you're going to be looking for residential care, you always reach out to someone, maybe from that organization, and always work with someone who's in the homes. There's a few online sources that can be, they can provide you a list, but if they've not been in those homes, I would be very reluctant and especially to go explore on my own without someone with you that does placement, that can answer the questions or bring up questions that maybe you wouldn't think about. It's really important to be in contact with someone like that.
Great, thank you.
So, so I'm going to talk a few minutes about the pros and cons. So the pros of a personal care home, for me, it's a small home-like environment. So we talked about them being able to, sometimes when they're coming from home and they've held out as long as they could and they wanted to be in their own home, this type environment is better than trying to move to a large community where there's tons of activity, it's overstimulating. They may not want that. A lot of times the kids want that for them, but the resident themselves don't really want that. So it's just one of those things you have to process through with the client. The resident to caregiver ratio, you're looking at maybe 1 to 4 in some situations, 1 caregiver to every 4 residents. So when you compare that to larger communities, being one of 12 to 15, your care is going to be better. They're more attentive. Falls still happen, but they can go down in number because you hear when they're moving around. You know what they're doing, and you pull them out of their rooms. Hopefully, they have a right to stay in their room if they want to, but getting them out so they can socially engage with the other residents and things like that. You have your eyes on them, in these small environments. It's usually more economical for a family long-term because as you're in a large assisted living, you pay your base rate and then you pay levels of care. So as the healthcare needs go up or their health declines, their care costs go up. And with most of the care homes here in Texas, whatever you go in at is usually what you stay at. And so from a budgeting perspective for families, that's very helpful because they know what's going to be going out every month for the next year or 2 years, whatever it may be. In the large,
So personal care homes
mhm,
tend to have steady expenses, so everybody understands that versus assisted living, which typically goes up over time.
yeah.
Yeah.
Mhm.
Okay.
And they may even like, okay, well, she's pretty high level of care, so they may add an additional, 500 to 1,000 coming in, but
Hmm.
they don't, they rarely change it. So,
Hmm.
but that's a discussion that I, as a specialist, would go over in front of the family, and a question I will ask that care home provider is, how often are their rates going to go up? And most of them will tell you, well, it doesn't really. What they come in at is stays at, and that's a
Yeah.
blessing to these families, especially because it is expensive,
Hmm.
and some states are a lot more expensive than Texas. So, um, so I covered all that. If and if a resident, I think I kind of covered this, if they're looking for a calmer environment and not that cruise boat feel of always something going on, is, music playing, all that kind of stuff, but they just want to like be in their room and read, or they want to do, watch movies or whatever. Sometimes this is better because you're paying for all those activities that they're not going to partake in. So,
Hmm.
um, anyway, I see these care homes as being a great alternative to skilled nursing facilities for those residents that have a little higher need, but not necessarily skilled level care.
And what about, you talked a little bit about your personal story with your mom. What about people that have dementia specifically?
That is a great question. So in the large box assisted livings, you'll have memory care communities, and they may be part of an assisted living community or they may be freestanding. But they're all type B. So we talked about the types.
Hmm.
In a residential care home setting, there are a few that have Alzheimer's certification, certified. And so what that means for the care home is that that staff has to have so many hours of training on working with dementia residents throughout the year. So, and it's a secure environment. So they have to be coded in and coded out. So the other care homes can still take care of dementia patients. Um, when they could not, would be things like they're combative, they're going to hurt themselves or someone else. They're a wanderer, they're constantly going into other people's rooms and then getting argumentative with them because the other person wants them out of the room, that could happen.
Yeah.
Or they're an elopement risk. So a residential care home for someone that's constantly exit seeking is not a good choice.
Hmm.
So
Yeah. Let's see. So Annie said, my dad with a private room in Washington, dementia care included toileting is 10,000 a month, and they are absolutely magnificent.
yes.
That's great. Yeah, and so one of the things, and thanks Ray for bringing this up, is addressing the actual cost per month of these homes. So,
Okay. So every state's going to be different. And I can tell you now that East Coast and West Coast are a whole lot more than they are here in Texas.
mhm,
In Texas, um, a personal care home, you can be, some of them have a shared, like they'll take the master suite and they'll make that a shared room, and they will charge, usually starting out 3,500 to 4,500 for a shared. And
mhm,
then private rooms in these care homes will go anywhere from probably around 5 to 8. 8 is usually like a master suite by yourself. You don't
mhm,
you don't have to share it with anybody.
mhm,
So that's kind of the range here in Texas.
mhm.
Um,
How do
for
how do these personal care homes address resident safety?
Resident safety. So the licensed ones, I mean, there's rules in place, right, to make sure the residents are safe. You've got the fire and safety codes, they've got inspections, they've got, the fire department has to come out yearly and do an inspection. I mean, everything's regulated by the state. So in the unlicensed care homes, you don't have all that.
Mm-hmm.
So that is one of the cons of being in a unlicensed environment, is that you have some of those safety concerns. They don't have a fire suppression system. They may not have policies in place. And if you don't know where you're going, you could be putting yourself at risk for abuse, neglect, and exploitation, because there's no one um, overseeing and guiding that home on who background checks, um, state versus nationwide, all that kind of stuff. So they are a little more, of an issue for safety, the unlicensed for sure.
Mm-hmm.
That's why again, I don't work with them if they don't have a nurse owner.
Mm-hmm.
So,
Yeah.
um, and so I was going to say a little bit about our particular franchise. We have like 137 placement specialists across the US. And so nearly every state, there's someone that does what I do. There's
Mm-hmm.
also other franchises. There's people who individually do what I do. But I would just say that don't ever try to do this on your own. Um, Always get someone who's in this industry, and just know that we don't 95% of us, it's a free service for you. When we do get paid, we get paid from a community. So it's more like a finder's fee kind of thing.
Mm-hmm.
But when we find somebody places, we know they're potentially the best spots for them based on, their finances, their medical needs,
Mm-hmm.
and location, how close they are to family members and stuff. And you always want family, no matter where they go, whether it's licensed or unlicensed, they need to be involved. They need to be going and seeing that resident. They need to be watching what's going on. And if things aren't going well, that needs to be turned in to the state.
So that just brings up a question about solo seniors and those without finances. I know you touched on this for a moment, but how do those people address their needs? Where do they end up? Do they end up in personal homes? What happens to them?
Yeah, some of them can end up in what we just, it's not a board and care, it's more of a boarding home.
Mm-hmm.
I don't refer to boarding homes. I don't refer to group homes. So those are kind of out of my league as far
Mm-hmm.
as um, and the reason is I take very strongly the responsibility of making sure they're in the right place. And if I can't feel good about that, then I can't suggest anything that
Mm-hmm.
is not going to be the best fit for them. So if they don't have any money, then we're trying to point them to resources as far as
Mm-hmm.
Medicaid. If they were a veteran,
Mm-hmm.
Veterans Aid and Attendant can help pay for being in a care home setting. Long-term care insurance can help, but if they don't have any money, they don't have long-term care insurance. That's something you pay for all your life, and it's expensive.
Right.
So it's basically Medicaid, because it's all self-pay, they would have to qualify for Medicaid.
Mm-hmm.
And in Texas, like let's say you have a dementia diagnosis, it
Mm-hmm.
doesn't pay for memory care in anything outside of a nursing home.
Medicaid
So,
doesn't.
right, not in Texas. So
Okay.
if you have a dementia diagnosis, that will qualify you medically for the nursing
Mm-hmm.
home. And if you have no money, then you should qualify financially. And then we
Mm-hmm.
just need to figure out, can you live amongst the general population in the long-term care, or do we need to find you a skilled nursing facility that has a secure unit?
Mm-hmm. Got it. Okay. So skilled nursing is generally where those residents would be going. So Judy Cushman, nice to see your name and your face. What's the guideline about how to deal with issues if there's a concern about care for a family member?
So if you're the family member and you're concerned about care,
I
is that
think
what?
care for a family member in one of those residents, in one of those personal
So
homes.
if you're concerned that they're not meeting the needs, your first line could be, if you're in a licensed community, is to reach out to the ombudsman.
The long-term care ombudsman. Yeah,
Yes.
that is in
And if
every state.
mhm.
Mhm.
And if that is not fixing the problem, then you can go to the Health and Human Services Department that does the inspections on these homes and file a complaint there.
Mhm.
And then on the unlicensed care homes, it would be a matter of calling APS. And APS will come out, do an evaluation of what's going on. If
That's
they,
adult
yes,
protective
protect,
services that every state has. Yeah.
right?
Hmm. Hmm.
So those are the main things, is calling adult protective services, getting someone out there to, see what's going on, and then they'll deal with it.
Yeah. Well, an adult protective services is if there's like an imminent urgent thing, they deal with that urgently. Um, and I remember when Beth and I we did quite a bit of work with the long-term care ombudsman in Washington State, and they're very responsive. Like I don't know, I think they have like standards on how quickly they respond to inquiries, so
Yeah,
people
they
can
have a
ex
timeline that they have to
hmm.
meet, and they were very good about that. Yeah.
Yeah,
I don't think very many people actually know about it, especially
yeah.
family members. So it's really great to know about.
Services will come in and evaluate. I have a situation recently that's APS involved, and they can't really make the gentleman move or do anything, and neither can I. We've both tried lots of things, but it all boils down to he still has rights, and can choose how he wants to live. So, but we did our part, and we talked, we turned it in, and they dealt with it, and then we worked together to try to fix it, and we were unsuccessful, but that was the gentleman's choice. So
Hmm. Yeah.
we can't make them. So, people who would not be good um, fits for a residential care home, kind of talked about some of them being an elopement risk, a wanderer, combative, want to fight people all the time. Um, the other one that I would say that people don't think about is sometimes you'll have little seniors who have dementia, but they just holler help all the time, or they're yelling and crying all the time kind of situation. It's not that they're necessarily hurting, they may be, but it's just what they do in their dementia state. That would not be a good fit for a residential care home because it's a small environment, and you can see how that would be disruptive to, other residents in the home. So you want everybody to be happy. So that
Hmm.
probably would not be a good choice for
Hmm.
someone like that.
And I see Annie Jacobson is part of our community today. I just wanted to give her an opportunity in case she wanted to weigh in as dementia care coach um, in terms of this topic. Annie.
Hi.
Hi. Nice to
Sorry.
see you.
Um, as far as dementia, I think adult family homes are fabulous. I'm sorry, I had a call come in, so I didn't catch the last comment of it. But the somebody who's always lived in a home, a private home, to move into more or less an apartment building is very difficult, especially when you have dementia. So these smaller adult family homes, as we call them in Washington, um, are a calmer, a higher ratio of care to that person. There's a homeostasis that happens more quickly in those homes. So I think they're fantastic. Uh, my father's in one, 4 other dementia residents. They do great with each other. One of the things that I see is 3 of them had behavior issues when they came in. And in a large community where you've got staff rotation, not that same set of eyes or very cohesive set of eyes. You know, we have a team that works 4 days and then they transfer in a very managed way to the next team. They can do slow and low medication changes, behavioral adaptations. They can do, okay, he doesn't want to get up for breakfast yet. Let's try again in a while. Those things that somebody with dementia needs are more available in the smaller environment with a higher ratio of care. My father needed his hospice re-eval the other week. They came in at 1 o'clock. They had needed to do it. Dad wasn't having it. It went horribly. He's fine now, but he was combative. My dad is not combative. But because they needed to do it on that schedule, it didn't go well. And that's more what you're going to have in a larger community. So I think, and you do need to watch them. When I'm hearing you say unlicensed, it just makes my gut queasy, because there are some churn and burn places. There are some places that are running at the bottom of the barrel. The vast majority I've had engagement with are heart and soul qualified, compassionate people who really care about what they do and more or less become family. So there's my wheelhouse about it. I think it's excellent for dementia.
Thanks so much for jumping in. Appreciate your contribution there.
Total agreement with you. I think it's a great alternative to being in a larger memory care community. And they do have the flexibility to be able to allow them to do things on their schedule. Where in the big ones, you know, everybody's up at this time. Now we're at breakfast. Now we're at this. Now we're, you know, and that just really doesn't work well with some of them. And the way a lot of the larger communities want to deal with that is medicate them. And in the smaller care home environment, you a lot of times see a lot less medication like that happening to control behaviors.
Yeah. And where the one guy would say, I'm going to get a gun, and he'd run out in the street and be screaming. And because they were able to work with him personally, within 2 weeks, he was stable. He was comfortable there. I think the windows that you're going to have in a house versus long hallways in some assisted living potentially without windows, all of those things help somebody just settle more easily and build a quality of life for themselves there. So.
It also makes me wonder, Mitzie, thank you so much, Annie, for popping in. It also makes me wonder if there are personal care homes that focus on a particular type of person or diagnosis. Like, are there certain, you know, I don't know, homes that specialize in certain aspects of people, either medically or personality wise?
Any specific to, you know, as we age, we're all going to get some dementia possibly as we age because our brain shrinks, right? So we know that going in. So we have people at all different levels and different types of diagnoses, like Lewy body versus Alzheimer's versus vascular. You know, I don't see anybody taking only Parkinson's or only, you know, vascular dementia. I don't see that. It's a
Okay,
mix.
that's what I was
Here in
wondering.
Texas.
Yeah.
I mean,
Because
it might be good if they had a focus like that, but I have not seen that here.
One thing I
It's
have seen is that there may be male homes or female homes if somebody's more comfortable with that. And then as far as a specific diagnosis, somebody with Parkinson's, that it's a larger person that's likely going to need a 2-person lift, maybe they're going to not have 3 of those in one home. There may be that kind of qualification, and that's what the individual RN homeowner will be watching for. And we never know what's going to progress with someone. but them trying to look at that reality of, will these two people suddenly be too much for my team? So
Mhm.
It's
Times
to, I
they will
wanted to just
recognize.
say, oh,
Go
sorry,
ahead.
Mitzi.
That's
No, I
okay.
just wanted to say how this is so valuable. I've had 4 family members in adult family homes, and it's just a lot better than what people think it will be. But the frustration is not a lot of people know that this is an option. And social workers, when you're going through transition in the hospital, aren't, that's this is just not part of what they are offering. So I think it's really valuable. Thank you.
To say something to that. So the social workers in the hospitals, if they ever do give you a list, I would be concerned because it's
Mhm.
more based probably on, oh, I'm friends with this person than, oh, I've been in that home and I know the kind of care they provide, you know. So be wary of that. And I don't know, you want to be careful when you're using, personal care homes because there is risk involved, but there's risk, with assisted living anywhere, right? I mean, abuse, neglect, and exploitation can happen anywhere, even in the
Mhm.
licensed setting. So, but working with people who are in the homes and touring other families in there frequently, it's all, you know, it's a safer bet that you'll be okay there.
Can I ask you when either a family member or an advocate works with a professional like you, what are the types of questions that they should be asking to know that whom they are working with is, high quality and all that kind of stuff?
First things I ask, so I get calls all the time to come look at this new care home that's opening. And one of the first questions I ask is, what is your background? As the care home owner, what is your background? If you're coming from engineering, and you've never been in the medical field, okay, well, tell me more about how you see this happening. And, because engineers are pretty brilliant and they can switch modes of what they're doing, but at the same time, feel like you have to have some experience in the field coming in, to give the best care.
Mhm.
So when it's a newbie and they've never done this before, that, I give it time and see how they do. Um, and I work with a lot of other placement specialists and we talk. So, and
Mhm.
different companies, not just, my particular company, but MPRA, it's a good place where we bounce things off of each other, as far as various care homes and, what we see and what we hear.
So the National Placement and Referral Alliance that you mentioned before, NPRA, Um, so do placement specialists like you get either licensed or recognized or member or how when somebody, an advocate or a family member is choosing the placement specialist like yourself, what are some things to consider?
Me? Again, I'm just medical, and so that's the first
Mhm.
thing I really appreciate in someone. But you can go to the NPRA website and you
Mhm.
can look for certified placement and referral specialists,
Mhm.
and it'll pull up. It'll ask you for a zip code, and so you put in your zip code or city, and then it'll pull up the ones closest to you. That just means we're a member of MPRA, but we also have taken the time to take their certification to be having that CPRS
Mhm.
designation. And I do have that, but not all of them do.
Yeah. And Deidre, did you want to ask a question or comment?
Yeah, I just wanted to make a comment. So I believe the question was, what do you need to ask someone like Mitzi when you're working with her as a layperson or as a patient advocate?
Correct.
So, I'm just going to help you guys out here. So, as a layperson, I would look up on their website, call them and ask to speak with them, ask other people about them, whatever you can to get to know them. And then just reach out to that person and see if there's a connection. Now, as a patient advocate, I look at background, integrity, their reputation, who have they worked with before, will they let me go with them when they're going to look for a place for my client? So Mitzi and I have done a lot of that. We're going together as a group to look at some of these places to see if it's a good fit. Also, I'm looking at the residents, how they look. I kind of pull over a staff member and I say, hey, how long have you worked here? Would you have your mom be in this place? And if they say, I've been here 2 days and this place sucks, well, then I'm walking out the door. So, so that's how
Not
I look
fair.
at it. So Mitzi and I work together a lot because I depend on her to help my clients know that she's going to sit down with them. She's going to do an assessment to find out what their needs level and everything like that. And she's going to guide them by holding their hand and taking them from place to see what fits. It's not about the money, it's about the mission. And clients are usually very happy because they feel like they got that support. And then we're looking at things differently because we're nurses. I'm looking at the smell, I'm looking at how the staff are treating each other. Does the food smell good? What activities, how people are reacting to one another, how's the staff or how the residents reacting to each other. So I'm looking at all that. When you're going into a place, you want to use all 5 senses. And then when you're building a partnership with someone like Mitzi or another assisted living locator, you want to have that partnership where we understand we're on the same page for this client.
Mhm.
So I hope that helped out.
That's great. Thank you so much. Yeah, that was
You,
perfect, Deidre. And we are almost out of time, so I just wanted to give Mitzi one last chance to kind of wrap up. And any other pearls you would like to share with us before we close out today?
would just say, like Deidre just said, when you go into the home, be with someone who knows what they're doing. Ask the questions. A lot of times the low residents will just tell you, they're happy. Most of the time they're happy with the care that they get. Food is always an issue, no matter where you go, because you're never going to hit everybody's like point, right? But it is a great alternative to a nursing home. And not to knock them, nursing homes, they definitely we need them, because some residents, that's what they need medically and that's what they can afford, with help from the state. So we're thankful we have them. But just keep in mind, care homes are actually finding a professional to work with if you're ever considering it. Care home as an option, because you want to be making the right choice the first time, so we aren't moving your loved one multiple times. That's not the goal. If you're working with someone and they're calling you in 2 months and said, hey, I heard about this new house that opened over here, you want to you want to check it out? No, that's called churning, and we don't do that. It's not in the best interest of the residents ever, because once we get them settled, they need to be, left be and let them settle in and let that become their home. So, anyway, I just appreciate the time you guys allow me to share with you today. And I'm always here. You can email me. You have any questions, call me. I'm open. I'll talk with any of you. Again, I'm sorry, I don't know every state rule and regulation concerning, but the MPRA, you can go to that website and find people who are in your state that can help you.
That's great. And I just want to thank you. I've learned so much today about these homes, and also just like who might be a right fit. And I just wanted to remind everybody online that this will be made available through our classroom and through YouTube. So you'll get a follow-up email if you want to share this with anyone. I think it's super valuable information, and really appreciate, Mitzi, your time and your expertise in answering all of our questions today. Great to see everyone. And go to our events page. We have a lot of things happening in March and beyond. So hope to see you, especially at our Angst movie film virtual screening on March 24th. So hope to see you there. Thanks so much.
Thanks, Mitzi.
You appreciate it. Bye bye.